But right now, it's time to have a little slice of West Midlands life in the studio. My guest today is a Black Country healthcare worker who has recently received a top award for her commitment to patient care, which is brilliant. Lisa Birch is from Dudley. She works at Russell's Hall Hospital and was given the Chief Nursing Officer Award earlier this year, having worked for the NHS for 15 years. Welcome to the studio, Lisa.
Hello, welcome.
Congratulations.
Thank you very much.
That was nice. Did it come out of the blue?
Yeah, total surprise. Had no idea.
Did you have any idea you'd been nominated?
No, my boss nominated me, Stacey. She writ apparently quite a lot about me, and yeah, that was it.
That's amazing. So did you get a phone call?
No, the guys all got me together in one of our areas on critical care, and then I met Martina, and
Who's Martina?
She's our chief nurse. She's with me today as a bit of support. Yeah, and they met me and they gave me my award on my certificate.
Were you on shift at the time
I
then?
was.
What an amazing surprise.
It was lovely. It was really nice.
Were there tears?
Yeah, tears, and I was actually speechless, to be honest. So yeah, it was lovely. Really nice.
Is that unusual?
It's very unusual for me. I've always got lots to say.
Let's take you back then. Let's go back. Where are you born and bred?
I was born in Wordsley in 1978, and then I grew up in Quarry Bank.
So Black Country girl.
I'm Black Country girl. Yes, I am.
What is it like family-wise? Whereabouts did you live?
I lived on a little place, the Caledonia Estate, and with my mum. I went to Peters Hill School, quite local primary school, and then I went to Thorns Secondary School.
Were you only child?
I was.
How was that? Because people always ask people that, and they're like, well, I don't know, because it's all I've known.
It's quite lonely, I think, so I relied on a lot of my friends, and then obviously, so I didn't want my son, who I had, to be an only child, so I ended up with 3 children. So yeah.
It's funny because I've got people talk about this, and I've got my mum's an only child, and she feels like she, missed out a bit somewhere.
You do feel like you missed out.
But my husband's an only child. I don't know if this is men and women. Couldn't give a monkeys.
Really?
Yeah, it says it hasn't had any impact, that he doesn't know any different, that he doesn't see why he would miss out on anything, that kind of thing.
I think seeing my 3 grow up together, I think the connections, even though there was a lot of arguing and fighting, I wouldn't change that for them, I think, and they've got such a good connection now together.
And have you found the only child thing it does have different impacts at different times of your life as well? Yeah,
I think even though people think that I'm quite open and I've always got lots to say, and I'm not shy, I'm very nervous, and I get a lot of anxiety for it, because I think when you've got someone by your side pushing you forward, it's so much easier. But
and
actually, I've never had that.
Siblings sort of automatically do that, even if they're annoying.
Yeah, even if they're annoying. Yeah. I think my kids have more confidence from each other, and I think the growing up thing's very different. It's a different way of growing up.
That's really interesting. So, okay, what were you like in school then? And was healthcare or care always a thing that interested you?
Definitely. I think I was always quiet at school. I was talking a lot, but I think I was quite quiet. Went out with my friends, and then I went to secondary school. I applied to do my nursing, but I had my oldest son quite young. So
how old were you?
I was 16 when I had him.
Was that a shock?
Yeah, I think it was. I think it was, especially as he's coming 31. So that was a long time ago, and I don't think it was as open as it is now.
Yeah. Did it cause? Well, I suppose it was a big adjustment for your mum as well. Totally
life-changing for me, and my husband, who is my husband now, was my boyfriend then, is my husband now. So yeah, we've been together all these years. So,
but I think it's interesting because, again, people treat it, I've just done it then, and I've asked, well, it was more whether it was a shock, because I think it could be a shock, but actually people treat it sometimes like it's that's a disaster. Actually, you had your first child young, you've got 3, you've got family, you're with your partner still. Yeah. You got it out of the way, didn't you, really?
Yeah, did it all, and still managed to get a career out of it as well.
Yeah, so you're a perfect example of how it doesn't have to be something out of the ordinary, really.
I think it's always hard, but then I say that having children younger is always, it was easier than having my last one when I was older. So obviously there's 5 years between each of them.
How? Why?
I don't know. I just think you become a little bit more selfish as you get older as well. And I think you decided we'd got a boy and a girl, and then my youngest came along, and it was like, oh, another one. So we had to go for it again, and we was like, yeah, it's fine, and it made our family complete.
It's interesting though, because I think a lot of people have kids much older. I've got a lot of friends at the moment in their early 40s with very young first children.
Yeah.
And you are different, aren't you?
Totally.
In some ways, and I'm sure there's pros and cons, right? Because in some ways you're more settled, or you can know yourself a bit more, but in other ways you're tired.
And me and my husband go on holiday and stuff now.
Yeah.
Got someone to babysit the
and
dog.
like you say, more selfish because you've been used to your own life. So it's really interesting. So
it is.
You managed, like you say, it must have been hard though to get your career through that time, or was it really after they were little that you pushed on?
Yeah, my husband obviously has always worked full time, so I got myself a little job at Sainsbury's before we got married, and then I did a tuck-in service, and I actually went to do my nursing. And I did a family friendly course, but because my youngest was only one, I couldn't do the hours that I needed to do at university, so I had to give that a miss. And then I went into a nursing home at Prestwood and did that for about 6 years, and I loved it.
That's
absolutely loved it.
Strikes me of people when you talk about care workers and people see it as like, it's like, oh, people go into it because they've got nothing else, or it's not rewarded well enough, which we all know it isn't.
Not.
But actually, everyone I talk to that's done care work loves it.
I think you have to love it to do it.
Because it's hard, but it's a passion.
And I think it shows with your patients. And because if you don't, they'll get you. It's body language, communication. They know whether you're there to care or not.
That must have helped with your nursing, though. That 6 years.
Definitely.
Being a nurse, though, not an easy job. Being on a critical care unit, not an easy job.
No.
Working through COVID.
No.
What would you say about what you learnt through COVID?
Oh, COVID was tough. I think it's affected us all. I think what I was saying to the girls earlier, like looking at people's pictures, memories, so difficult time, really.
Do you think you've processed it yet?
Sometimes. I think that there's a programme I think that came on Netflix that I haven't managed to watch. Yeah, I think as a team we bonded really well. I think we had to stick together. We had to spend a lot of time together. So yeah, that was it was difficult. It was a really hard time.
People talking about that it's maybe not acknowledged the amount of PTSD that
definitely.
is still in NHS staff, especially people who did what you did in a critical care unit.
Yeah, I think we didn't just look after the patients; we also looked after the families, and sat with them, held their hands. So yeah,
I mean,
difficult.
The idea of another one of those must.
I do
heaven
hope it
forbid.
Never, yeah, I hope we've come on from that now. But I think the people that said that they didn't think it was real, I think that's quite hurtful because it was. I don't know where you put it now. Now we've come so far on, but at the time it was very, very real. A lot of people lost their lives. So yeah, very difficult, and a lot of families still probably live with the upset of it all as well, to be honest. And I don't think you get over it, but I think you learn to live with it and put it somewhere.
Has it made you a better nurse?
I think it's made me more emotional. I don't think it's made me a better nurse. I think you just take different skills from it. I think that's what you take.
Well, you're clearly a brilliant nurse because you've just won this incredible award.
Thank you.
And I suppose, what would you say? People hear a lot about how difficult it is in the NHS, how tough it is, how much harder it's getting. Tough. But what would you say to anyone who was thinking about doing it?
Oh, if you care for people and you want something out of a job, then go for it. I think you get out of a job what you put into it. And I love my job on critical care, and I work with some amazing people, consultants, doctors, anaesthetists, other nurses, clinical support workers. They're all amazing, and we're all a fantastic team. And that's why I've been there as long as I have.
Yeah. And you know what? This was a national award, so you've done incredibly well. You think about the amount of people who do your job. Congratulations
Thank you
to
so
you,
much.
Lisa, because I can see why you've won it, to be honest. You're brilliant. And also, the thing about having kids young is you've got grandkids. You're a young grandma. You're a glamorous granny, I've got to say.
3 of them. They're lovely.
Got 3
I love them all.
grandkids. No,
Yes.
you don't look old enough, can I just say? But thank you so much for coming in today.
Thank you for having me.
Congratulations and brilliant
Thank
to
you.
speak to you. Take care.
Thank you.